Okay, now the most common opportunistic fungal pathogens are Candida, Aspergillus, that's responsible for a lot of lung infections, and the Cryptococcus that inhabits the soil that's around pigeon roost. Looking at the Candida albicans, this is a widespread yeast, and the infections can be short-lived and superficial skin irritations, or it can become a fatal systemic disease. It forms off-white, pasty colonies that have a yeasty odor, and this is normal flora in the oral cavity, and the genitalia, and the large intestine or the skin of about 20% of humans. Candida albicans accounts for about 70% of our nosocomial fungal infections. The vulvovaginal yeast infection is very painful. It's an inflammatory condition that's in the female genital region. It causes ulceration and discharge. A lot of times patients will get this when they've been on antibiotics that kill bacteria that keep the fungus in check, that keep this yeast in check, but when you kill the bacteria, the yeast reproduce and grow out of control, and it causes this problem. The cutaneous candidiasis is usually on moist areas of the skin, and you'll see this in burn patients. And then, of course, the brush. This is the thick white growth on the mucous membranes of the mouth and throat that can be especially painful, and you often see this in babies. To treat it, if it's superficial, they're going to use a topical antifungal. But if it's systemic, they're going to use the fluconazole or the amphotericin B. Now, pneumocystitis jirovecii and the pneumocystitis pneumonia, this is a small unicellular fungus that causes pneumocystitis pneumonia, and it's the most prevalent opportunistic infection that you find in AIDS patients. And it'll block breathing because of secretions in the lungs, and it can be rapidly fatal if you don't get it under control. Any fungus can be implicated in infections if you have a compromised immune defense. And it's unusual to become infected by common airborne fungi, but if your immune system is compromised, then the infections happen more readily, and we're seeing more of this now. The reason for atopic allergies is usually fungal spores. We have seasonal allergies and asthma from these fungal spores, and then of course there's fungal toxins, the mycotoxicosis, that you usually get from ingesting and inhaling these fungal toxins. Aflatoxin is both toxic and carcinogenic, and you find this in grains, corns, and peanuts, and it's lethal for our poultry and livestock. Which of the following is the causative agent of oral thrush? And I hope you know this. It's the only one we really talked about a lot. The Candida albicans.